That's the good news. Oh, you must have started.
All right. Well, thank you all for being here and tolerating the tight room here, and hopefully the temperatures stay under control. But really means a lot to have so many people here who I know have been working on this issue for a really long time, and many whom have been personally affected by the opioid epidemic. So it's really an honor to be here and announce some serious concrete steps and some resources to back them up that we're taking to address the problem. So I'll dive right in. A little bit of background, go ahead. A lot of you know this, but I think it's really important that we just situate ourselves in the fact that we are in a public health crisis. In the last 9 to 10 years, you can see 345% increase in our county. And we are now at the point, unfortunately, and we have to reckon with the truth that in 2018, Ulster County was the worst of 62 counties in New York State for opiate overdose deaths per capita. That is not something that we should be proud of, but it's something that I think we can and must use to rally ourselves and to turn this around and address it. And so that's really what we're here to do today. If you go ahead to the next slide, this is just kind of showing that trend over time. And you can see Ulster County, the red line, a particular spike in the last few years, and the green is the rest of New York State minus the city. Next, please. And then these are the 2018 numbers that I alluded to. Every county, and unfortunately, we have the distinction of right now being at the bottom. But again, I'm confident just by the virtue of the people we have in this room and the number of people we have in this room and others that are out there working, that we can turn this around. And so the goal that I want us to hopefully rally behind, and I'm confident that we will, is to reduce fatalities in Ulster County by 50% over the next 2 years. This is an aggressive goal, but in doing the work and doing the analysis, I think it's something that we can do. It's clearly something we must do, and it's also has to just be really a first step in ultimately getting to a place of completely eradicating this epidemic. But this will show that we can do this and take a meaningful next step. And so what does that look like? Next slide, please. There's three key pieces to this that I wanted to announce today in collaboration with lots of folks in the room and partners. So number one, there's been a tremendous amount of work done by many people I know of that are in this room today as part of Ulster County's Opioid Prevention Task Force. This was a group established by County Executive Mike Hine to recognize what we were already grappling with at the time and what has continued to grow. And there was a tremendous amount of research and analysis done by a group of over 50 dedicated folks across our community, public health officials and other community leaders, to analyze the problem, look at best practices, and lay out a series of really, really good and well thought through recommendations. So it's really my honor to now come in following that work and now get to the place of we've done the thinking, we've done the analysis, now let's take action and let's implement these steps. So I'll talk a little bit about some of those steps, but I also want to just thank everyone, many of you in the room today who were a part of that group. And this is just the beginning of now taking that work and implementing it. As part of that, and secondly, I think it's absolutely critical that I have a direct representative of myself. This is one of my top priorities, who will act to coordinate this on behalf of me as the county executive. So we're appointing our first ever director of opioid prevention strategy. This is not a new name or face to many of you. Mr. Vin Martello, who's been leading up a tremendous amount of this work already. It's really just just in the last, even before I took office, Vin and I have spent hours
pestering you,
talking about this. I mean, your passion for this issue, the amount of work you've put in, along with many others, but this is such a logical, natural choice, and you've done a tremendous amount of the work already. And so now we'll put more work on you and count on even more, so thank you. And then finally, and also critically importantly, we need funding and resources to implement this plan, and that's one of the most exciting things we'll announce today. We've now got we've been able, between federal and state funding, to have over $3 million cumulatively over the next several years to tackle this problem. So I'll break that down, but that's a big deal, and it's important to come up with a well thought out plan, but without the resources to do it, we can't get very far. So I'm just going to go, if you go ahead next, I don't want to take too much time today. We are going to be releasing the full report of the Opioid Prevention Task Force, but I do want to highlight just some of the key recommendations. There were 3 main areas of action and focus: reducing supply, reducing demand, and then improving treatment and prevention. So these are some of the key pieces on that first effort, reducing supply. I'm not going to go through each of these, and there's even more. I mean, there's about, I think it's 70 pages of detail that we'll be sharing on this. One of the things that I think is absolutely critical that I want to highlight, we are going to continue to apply pressure through the class action lawsuit against Purdue Pharma and other pharmaceutical companies that we now are learning more and more about how sinister a role they've played in driving the supply. So that's something that I'm proud that Ulster County is a part of. Of course, in cooperation with the sheriff, and he can talk more about this if he wants, continuing to resource urgent. Next slide, please. On the demand side, this is where I think we have a huge opportunity to continue to ramp up, particularly focus on young people. How do we use peer-to-peer programs? How do we continue to enhance the efforts of our Prevention Council and other prevention efforts throughout all communities, but particularly focus on young people? And then we already have undertaken a significant education campaign with prescribers and medical professionals, as well as patients, to talk about alternatives. And then finally, on the third area, next please, looking at how we continue to improve treatment. I'll ask the sheriff, he's going to talk a little bit more about number 1 there, which is one of the actions we've already taken in our jail to bring a comprehensive approach there that we're really encouraged by. Medication-assisted treatment, something that's already happening, but we need to expand and scale that up. And then finally, more funding and resources and training opportunities for Narcan, naloxone, and similar opportunities there. So go ahead next before I hand it off. So the money. This is a really big deal. The first program here, the Chase grant, is initiated at the federal level, but Columbia University is going to be our research and academic partner here. And after my remarks, we'll invite up Dr. Smith and Vin and others who can answer any more detailed questions or expand on this. But over a 3 to 4 year period, Ulster County alone, as one of 15 counties in New York State, is going to receive $2.5 million to ensure that we can actually implement all these actions that we need to take and properly resource a solution to this epidemic. So I am extremely encouraged and optimistic that we now have a solution, we have the right team, and we have the funding and the resources to really address the problem. I also want to thank the New York State Department of Health. In addition to the $2.5 million, we'll have over $200K per year over the next several years to supplement that. So very, very encouraging. And I'm now going to hand it off, if you'd go to the next slide, please, to our sheriff. Obviously, number 1, I just love working with our sheriff. And what I think is so encouraging is that if you look back 10, 20 years, we've really changed the mindset in the law enforcement community about how we address this problem as the public health crisis that it is, and not something that we're going to arrest our way out of. And I've heard Sheriff Figueroa speak very compellingly about this. So this is a partnership like many other things we're working on together. So thank you for being here, and I'll hand it off to you, Sheriff.
Thank you.
Of course.
Thank you. Of course.
Good afternoon, everyone, and thank you, County Executive Pat Ryan. This opioid epidemic hits everyone. It doesn't matter who you are, rich, poor, whether you're in law enforcement or otherwise. And law enforcement has taken note of what is transpiring out there. And it, as you know, the criminal justice system is multifaceted, and we cannot do our job without the other parts of the criminal justice system. So I'm very happy to see that the District Attorney's Office and the District Attorney, Holly Conrad, is here in his office, and with the way the task force is run, and it's a collaborative effort between the Sheriff's Office, the District Attorney's Office, and a lot of the local law enforcement agencies in the county. We still have to go after the drug dealers. You know, they're putting this stuff out there in the street. But we also know that a lot of these individuals that end up in the criminal justice system are basically supplying, that they're trying to get, they reach the tolerance level, and they're doing things that they normally would not do. And we are aware of that, and we're tackling and working together to make, to solve that issue and problem. And I'm proud to be a part of your team and the team here in Ulster County, because people are tired of talk. And me and Vince have had this conversation before. People want action from their government. They want action from law enforcement. They want us to change the way we look at things. When an individual is afflicted with addiction, that's somebody's son, mother, father, or son, or brother, or uncle. It's a family member, and we have to look at it that way. And the mindset is changing, and it's changing because it has to change. In the jail, we're looking at changing the way we do things there as well. And again, this is all in conjunction with the County Executive's Office and the Department of Health and Vince and Dr. Smith. And we discuss ways of how we can change the way we do things at the jail. We took a trip early in February up to the Albany County Jail, and they actually have the MAP program already in place, where they had addicted folks that are in with veterans. They separated the pod, and it's not just continuing on if they're in a program, which we will definitely do. It's also detoxing people and giving them an option of because one hat does not fit all. So we have to look at different options. And this community and Ulster County, they have a vast, there's so many different ways of doing things and looking at things, and we're going to look at that. And the task force, the Opioid Task Force, has done so much work already that I'm just piggybacking on some of the stuff that you folks have already been working on, and I'm proud to be part of the team. So I thank you all, and we're gonna tackle this together. Thank you very much.
So we've talked a lot about numbers and statistics and dollars and programs, but what I think so many of us in this room know, and many have experienced firsthand, is that for every statistic that showed up on a graph, there's a victim, there's a family, there's a community, and we all feel the ripple effect of this epidemic tearing apart our community. And so in everything that we do, we're going to always be thinking about the people involved, and that is our most important responsibility. My most important responsibility as a county executive is to keep us safe and to try to bring our community together in the midst of this epidemic and crisis that we're facing. So I'm really appreciative and thank a member of our community who's willing to be here to share her story and her family's story of how they were affected by this epidemic. As you hear this story and others, I ask you all to just keep that in mind at the moment that you might be tired or feel like we're up against a wall or we don't have what we need. We can't accept that, and so thank you for being here. I'll introduce Jillian Nadiak to speak for a few minutes as well. Thank you.
Thank you so much for coming out today. I'm here today to reiterate how important it is that we work hard to combat the opioid epidemic that we are facing. Unfortunately, I'm sure that many of you already have a person that you think of when you think of this issue. But today, I will give you one more. Not to gain sympathy, but to give you one more story to serve as a reminder of what we're doing. My brother Adam and I grew up together on the outskirts of Ellenville in Ulster County. We spent our childhood together until he joined the Army in 2004, as soon as he graduated from high school. He specialized in communications. Adam manned the border of North and South Korea for a year. He drove into the cities on the weekends to train with some of the most distinguished martial artists in the world. He served as a sergeant in the Afghanistan War, and he flourished in the military and was Soldier of the Year for the 67th Signal Battalion in 2005. He later worked as a contractor in Iraq before securing a position with Flight Safety International as an IT security disaster recovery analyst for LaGuardia Airport. Adam's life in the military can be summed up in a few sentences, and it's not because of a lack of content, but because, much like our grandfather, a World War II veteran, he didn't tell many stories. He left home, he served, and he came back. It took him a while to get back on track, but he got there. At least, that's what we saw on the outside. He was 30 years old when we lost him to an accidental overdose on prescription painkillers. He had been prescribed oxycodone as a solution for back injuries sustained in the Middle East. Surgery, he was told, was too risky. He wouldn't want to be paralyzed. He should just take the pills until he can't take it any longer. At least that's what Adam told me. Despite this back injury, in his almost 10 years as a civilian, Adam was training for his master's belt in Subak-do martial arts, was an active sport shooter, and enjoyed golf. However, my brother didn't only have a back injury. He also had post-traumatic stress disorder, something he kept incredibly well hidden from his family until he wasn't there to keep me from going through his things. That's something that sisters do, but I wish it didn't have to be because he wasn't here anymore. Over the course of several years of treating an injury and his mental health with these pills, he developed a tolerance and upped his doses a few times. Having never been given painkillers before myself, and Adam still functioning in society without a problem, I assumed the few pills he was putting in his hands and tossing back must have been what the doctors were telling him to do. On April 1st, 2016, America lost a young veteran. On April 1st, 2016, I lost my brother and my mother lost her son. My extended family lost one of its most accomplished individuals. Stigma is a terrible thing. Stigma prevented me from talking openly about what killed my brother for an entire year. Stigma is what prevents people who desperately need help from reaching out. And stigma is what colors an entirely different picture of the opioid epidemic and makes it a one-sided issue to those lucky enough not to have had it impact their families, which sadly aren't very many anymore. My brother was not a druggie, he was addicted to drugs. And if this could have happened to my brother, it could literally happen to anyone. And it does. It happens to mothers who get into car accidents, fathers with chronic pain from old injuries, sisters and brothers who have had their wisdom teeth removed, children who haven't been educated that just because it's legal does not mean that it is not lethal. The list goes on. Not every person becomes addicted, but every person runs that risk. It took losing my brother to realize that if I'm ever prescribed an opioid, I might have to refuse it, no matter how much pain I'm in. I'm so happy to know that the issue of overprescribing is being tackled right now. However, now we have to deal with the impact that this issue has had on our community. I just received an email today from a writer friend of mine. I've been working on a personal project where I take lessons I've learned from my grief and I put it down on paper. It helps me, but I hope that someday perhaps it might help someone else, others in grief and the veteran and addiction communities. I had asked her to review a part of it, and she responded by saying, "Do not, any under circumstances, abandon this project. It is so important." And when I read that, it made me realize that we've come a long way, but there's obviously still work that needs to be done. And this is why any literature, art, conversation, and so on this topic is so important. That's why these grants are so important. That's why these initiatives are so important. Ulster County has the same attitude my friend met me with on the opioid epidemic, and I cannot express just how important it is not only to me, but to all of the constituents, that Ulster County has not been abandoned. And Ulster County has not abandoned this issue, and they instead are attacking it head-on with vigor and passion. Today, the residents of Ulster County know that their county has their back, but we must all continue to work together from the ground up, from defeating stigma in our communities to providing the funding to implement programs that will heal them. Thank you so much for hearing my story.
I don't think anything else needs to be said after that. Thank you.
Thank you.
So with the time we have, we'll open up to a few questions. If I can invite Dr. Smith and Vin up as well, and the sheriff and Jillian. I also want to make sure to thank and recognize and put some additional responsibility on our incredible Commissioner of Health and Mental Health, Dr. Smith, who's been instrumental in all of these efforts up to this point, and who will be really the point in coordinating this implementation of this CHASE program. As we used to joke in my Army days, performance punishment. You do a great job. We give you more work to do. But please come up and join, and we'll open up to any questions that folks have.
Hey, sorry.
Hey, Jesse.
The sheriff might be a better one on this, but I don't see if you could specifics about what you're planning at the jail in terms of, are we doing medically assisted? Are we going to bring methadone maintenance into the jail or Suboxone treatment into the jail? That's something that we can expect to see happen soon? Yes,
so we are going to look at doing that. Again, there are going to be different options available once the individual identifies himself as being addicted. If they come in and they're already on a program, we plan to continue that program. And we're working in conjunction with the Ulster County Department of Health. We had a big meeting not too long ago at the Law Enforcement Center about it, and it's still in the early phases, but that is our plan.
Okay. And when they say expanding urgent, what does that mean?
Well, as you know, it's a multifaceted attack plan. Not only helping people, but actually there are people that are actually making money on this, and we have to go after those individuals. We're also putting together a team that's similar to the programs that you see throughout the Northeast, like Chatham helps. So we're putting a team together. We're going to set up a 1-800 hotline. It's going to be a plainclothes investigator, detective, and he's going to go out with a mental health professional, a peer advocate, and within 72 hours of somebody overdosing, we want to be able to give that individual the opportunity to go to rehab, and we want to talk to the family and see, because the family suffers too, and we want to be able to give the family options. And so that's what we mean by expanding the urgent team.
So it's a team. You have a detective and a mental health professional go out to know the victim's place and say, hey, do you want treatment? Talk to the family and see.
Correct, and we'll give those individuals the option.
Right. Thank you.
And one of the key, so CHASE stands for County Hub and Spoke Empowerment. That's the acronym. And a lot of the ideas that we're already doing an incredible amount of work across a lot of different departments and organizations, not just in government, but in all sectors of our community. But there are still these huge gaps where, you know, people leave a treatment program and then are on their own, and it's up to the family, or people leave prison or jail and don't know where to go next. So a big part of the approach here is to plug those gaps and to ensure that there are these pathways to recovery for those suffering with addiction. And that's really, and feel free to add, but that's really kind of the heart of this CHASE program, which we're very excited about.
And somebody we'd like to recognize is Dr. Tim Hunt from Columbia University, who's one of the lead developers of the grant proposal that was submitted. That was one of 4 in the country that was accepted, and his work with Columbia University Department of Sociology and his various other colleagues We owe them a debt of gratitude for remembering us in this initiative, and we really look forward to that partnership. So thank you, Dr. Hunt.
Absolutely.
And an Ulster County resident.
Yes,
And
he
thank you
is.
for, thank you for being
One of the things that I've heard sort of time and time again is the problem of getting people into treatment centers, insurance issues, and those kinds of things. How will this group, or will this group, address the problem with insurance companies and needed rehab?
And feel free to jump in, but the idea is absolutely yes. I mean, any of these gaps or friction points that people are experiencing, that's the whole idea, is to identify if we haven't identified, and then resolve and remove that blockage or that friction. So there are a bunch of pieces to it. I mean, for example, I know what Ellenville Regional is doing from the medication-assisted treatment perspective is an example of that, where patient coming in to the ED to be treated for overdose is immediately administered treatment, so that there is no gap, and they've figured out how to address any of the insurance or funding issues, so that for the patient it's a seamless ability to actually get treated.
And to add on to that, we do have a family advocate funded by the county,
Carol Sutcliffe is
there
right
she
there.
is, whose job it is to really connect individuals or families in crisis with the appropriate treatment and recovery, but also to advocate on their behalf with insurance companies. The other piece of it that we're working on is there's a new opioid court developing in Ulster County. It's the formerly it was the Ulster County Drug Court, which is part of the City of Kingston court system. The judges want to expand it to an opioid court. We've been meeting with them, and one of the barriers they identified is that a lot of people come in without insurance, and so the protocol calls for basically postponing prosecution for up to 90 days, getting that person right to treatment, and then reassessing afterwards. The problem is that a lot of people come in without insurance, and it takes several weeks to get them onto a Medicaid program. We're trying to streamline that, where we can start that application process immediately with a phone call, and then really expedite that process so that they get insured as soon as possible. And then working with the providers out there, the treatment providers, to do their evaluation and intake process, pending funding from insurance coming on board. So we're taking a look at all of those gaps one by one and figuring out the best way to knock them down.
Okay, I think we have time for one more question from the press.
Patricia,
How many fatalities have you had this year? Opioid fatalities.
Do you have the latest?
It's
I think we're doing, in that sense, better than prior years in terms of numbers.
I don't have the number offhand.
We don't have but almost half at this point.
We'll get you the number.
We'll get you the
Exactly.
number.
Thank you.
But things are turning around a bit on that.
I have it on the spreadsheet on my
Right.
computer, but I just don't want to misquote it, so we'll
Right.
get you the number.
And that was my question at the beginning of the your press conference. You put up some statistics and some numbers. I'm wondering where those numbers come from, and if they are 2018
Those
numbers,
are-
or if they're prior years.
We
in
can get
2018
you all that
report.
information.
Yeah, so those were the most recent data we have is for year 2018, and so ending at the end of 2018. We obviously have our internal statistics for the county for 2019, which we'll get as well. But all the charts were up through the end of 2018. One of the other efforts here is to work to better collect and use data to drive all the addressing and identifying all the gaps and improving solutions. And we still have work to do in that regard as well. That'll be a key part of this. A lot of the data that we showed here was provided by New York State, who has stood up, I think it's the OD MAP program, which is basically an effort to better capture and analyze overdose data across the state. That's how we unfortunately know that we are not doing well vis-a-vis other counties. Is from that data set.
New York State has an opioid prevention dashboard where you can look at Ulster County, you can compare it to any number of other counties in New York State. You can compare it to the state and region. Those numbers are a little bit lagging. The most accurate information is our own, which is right from our medical examiner from the toxicology reports. It appears that the numbers are trending downward. However, you know, that could be for any number of reasons, and so we're still continuing to press forward, and in fact redoubling our efforts, because any number of fatalities is totally unacceptable. And we're just going to eradicate this epidemic.
Do you also have statistics on how often the antidote, if you will, is used, the Narcan?
Yes, we can get you those, and we also building through our crime analysts for the high intensity drug trafficking area, which is part of which is an executive agency. We're looking at she helps us create what's known as a vulnerable persons list. These are the people that repeat within a certain time frame, who repeat overdose, and so what we're setting up plans to reach out to those individuals, to hyper focus attention on them, and not only them but their families and associates, so that we can break that cycle of relapse and possible with possible fatal consequences.
Great. So I want to get Jillian, can you spell your name for me, please?
Sure, Jillian. Nadiak is N as in Nancy, A, D as in dog, I-A-K.
And where are you
Thank
from,
you.
Jillian?
I live in Kingston now, but I'm from Ellenville originally.
Thanks.
Do you want to come?
Well, I actually wanted, if you don't mind,
Yeah, of course.
I wanted to thank the county leadership from Columbia University. We are very privileged you were part of us getting funding, because we did a pilot here in Ulster County. And NIDA, National Institutes of Drug Abuse, National Institutes of Health, were very impressed with our county leadership. And our site visit, that was one of the things that stood out among other states. So it's actually the largest study in history of this type in the U.S. So we're very privileged to be a part of it in New York State, and 16 counties actually. We added one since funding. The highest rates of overdose are included. And it's called the Healing Communities Study. So if you see that, there are several initiatives that will be coming out, new criminal justice related initiatives that we hope to be also a part of. But this Healing Community Studies is community driven, community led, and we hope these resources will really move the dial forward and reduce overdose deaths by 40%, but at least by 50% according to the county.
We're going to go even.
You're going to go even higher.
higher.
Yeah, absolutely. And part of it is that there's a data dashboard that actually is designed for counties to help data-driven decision-making take place.
Right.
So we'll be working directly with the commissioner and the team here to devise and design that dashboard.
You said there are 16 other counties in the state. Are there any
Yeah.
other counties in the Hudson Valley?
Actually, yes. So Sullivan, Orange, Greene, Columbia are our neighboring counties, so there'll be some clustering there. And then we're also reaching out to the west, in Erie, Yates, but also Suffolk are part of that. But we have work in New York City focused on counties where it had to be at least 40% rural. So there's a looking at the impact of both urban and rural approaches.
Thank you.
Great.
Thank you.
Thank you.
I want to be respectful of everybody's time, so if anyone needs any more, we can provide more background info. We'll get the question answered on the 2019 statistics, and we will also be putting out a written release as well. But thank you all for being here. I especially want to thank Jillian for your continued bravery in sharing your story and ferocity in advocacy. You're inspiring all of us, so thank you, and please keep pushing us. So even in the midst of this challenge, I am positive. I think this is we're taking the action needed. We have the resources, as I said, and I'm optimistic that we're going to tackle this, and we're going to, as Vin articulately said, we're going to eradicate this. So thank you for being here, and I ask your continued help as we go forward, and enjoy the rest of the day.
Thank you.